Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now the next type of incisions in the diaphragm is we have the are already actually circumferential incision, central tendon and radial incisions are present in diaphragm. So circumferential, this is central tendon incision. Now we have to see the radial incision. Now, right. So this is the radial incision which is present. So according to the we have circumferential incision and central tendon incision and radial incision. Now in the radial incision, the incision is something like this. Because it is like this, it will transect the cut the nerve fibers, okay, because it is transversely present, radially transverse, or it is also called as transverse radial incision. So because of this transversely present like this, it might ensure the phrenic nerve or branches of the phrenic nerve. So thus, because it intersects the branches of the phrenic nerve, especially it intersects with the crural and posterolateral branches of the phrenic nerve, and thus it will result in segmental diaphragmatic paralysis is common with this radial nerve with this transverse radial incision. But the thing is, this transverse radial incision is relatively safe. It is also relatively safer incision, and also it is made mid axillary line. From the mid axillary line it is made to the center. So if this is the mid axillary line, from there you will make an incision to the center like this. Okay, this is transverse radial incision of the diaphragm.
thank you and thank you for watching.